Welcome to the deep dive. We're seeing this huge global push towards digitalization in healthcare, especially with electronic medical records, EMRs.
Yeah, they're becoming pretty widespread.
Exactly. And today we're doing a deep dive specifically into EMRs, but looking at them through a really crucial lens, how they're being implemented and what impact they're having in developing countries.
Right.
We're going to unpack a recent study that, well, it maps out the research landscape over the last decade or so, 2014 to 2023. What jumped out at you from its overview?
Well, what's really fascinating and probably, the main reason for this big push is just the sheer potential EMRs have for healthcare in these regions.
Okay.
I mean, think about it. Getting rid of lost paper records altogether, seriously cutting down operational costs, saving valuable time in really busy clinics.
That alone sounds huge.
It is. And beyond that, they can dramatically improve how care is coordinated, the overall quality. And this isn't just like an efficiency thing. It's actually vital for tackling some big systemic problems, like the
Yeah.
shortage of clinical staff.
Right, freeing them up.
Exactly, letting them focus more on actual patient care.
Okay, that sounds like, well, a total game changer for places facing those kinds of healthcare hurdles. But here's where it gets interesting. Looking deeper at the study, it revealed something kind of unexpected about who's actually doing this research.
hmm
You mentioned this sort of upward trend, maybe variable, in EMR research in developing countries, but the study finds that a lot of this research is actually coming from developed countries, particularly the US.
Yeah,
What does that tell us about maybe the reality on the ground or, I don't know, the nature of the research itself?
that's a really critical point, isn't it? It's a bit of a paradox.
Right.
It suggests that, okay, the need is recognized, the benefits are understood globally, but the actual doing it, the implementation in developing nations, it faces some serious roadblocks.
Okay.
And it means a lot of the investigation into these systems isn't necessarily coming from, within those countries themselves. The study points to some key challenges, things like limited tech infrastructure,
Like internet access.
power. Exactly. Unreliable internet, patchy power supply.
Mm.
Also, not enough training for the healthcare staff who need to use these systems.
Right, that makes sense.
And then there are serious data security concerns that can really erode trust. Plus, you have very real cultural barriers.
Yeah.
Maybe a preference for the old paper records or just a general skepticism about new digital systems.
Mm. So even if the tech is great, adoption might lag.
Precisely. It can significantly impact adoption, no matter how beneficial the technology might actually be.
So connecting this back to the bigger picture then, it sounds like EMRs are definitely a powerful tool. They can improve healthcare quality, efficiency, despite these big hurdles. The research confirms they're needed, and they do have a positive impact.
Yes, absolutely. The evidence points that way.
But given those challenges, the study must have also flagged what we don't know yet. What are the kind of crucial knowledge gaps for moving forward?
It absolutely did.
Right.
While it validates the need for EMRs, it also shines a light on areas that are, well, still pretty unexplored in this context.
Like what?
Things like health worker attitudes. How do they really feel about these systems? What about effective patient education? How do you get patients on board? And then there are advancements in health tech,
Yeah.
like telemedicine, remote consultations, and CM health using mobile devices for health.
Oh, okay.
These are still significantly under-researched, specifically for developing nations.
And you'd think those areas hold massive potential, right?
Yeah.
Especially for reaching remote or underserved populations. You mentioned the Mozilla mobile EHR system.
Exactly. Mozilla is a great example. It shows how mobile apps can really extend the reach of EMRs,
Mm.
making healthcare more accessible, more efficient, even where traditional infrastructure is, limited.
Mm-hmm.
Understanding and actually investing in these overlooked areas, worker attitudes, patient education, mobile health integration, that could really unlock the next big transformation in healthcare.
So for you listening, consider this. How could investing in understanding and fixing these specific gaps unleash that next wave of healthcare transformation? Not just for developing nations, maybe, but could it offer insights for, well, healthcare systems everywhere? What role could progress in these sort of neglected areas play in truly universalizing quality healthcare, making it real for everyone everywhere?